Well, good morning, and thank you for joining us today. It's not often I have the opportunity to present someone like Vice Admiral Rocky Bono, who was appointed by Governor Inslee on March 22nd, Director of Washington State COVID-19 Health System Response Management. This is a critical position to ensure a coordinated and effective response to the COVID-19 pandemic across Washington State's healthcare system. Her three priorities are protect our frontline healthcare workers, optimize all of Washington's health resources, and keep our Washingtonians safe. Trained as a trauma and critical care surgeon, she served as the head of casualty receiving for the Fleet Hospital during Operations Desert Shield and Desert Storm. Upon returning, she worked as a surgeon at Naval Medical Center Portsmouth and as a surgical intensivist and attending surgeon at Centera Norfolk General Hospital. Vice Admiral Bono's leadership roles include serving as Deputy Director of Medical Resources, Chief of Naval Operations, and as Command Surgeon for the U.S. Pacific Command. Her personal decorations include 3 Defense Superior Service Medals, 4 Legion of Merit Medals, 2 Meritorious Service Medals, and 2 Navy and Marine Corps Commendation Medals. Again, it's my honor and privilege to introduce you to Vice Admiral Bono.
Thanks very much, everybody. I appreciate it. I don't know if Dr. Lutz shared with you, but I officially retired from the military about 6 months ago. So it means I really failed at retirement to come find myself back involved and on the front lines. I do want to tell you, though, that it's been a real blessing and an honor and a privilege to be able to be asked by Governor Inslee to come here into the state of Washington. I knew coming here that you guys had a very high reputation for the type of medical expertise that you had in your healthcare system. You already had healthcare systems that are well known across the country. So I knew it was mostly a matter of being able to synchronize everybody's efforts. What I have found since coming here is the engagement of the leadership at all levels, right from the governor's office all the way down to the community level. And what's particularly gratifying is seeing the engagement of the community, the people of the community, and how well the leadership here in each of the regions and counties that I have visited, how well the community has been receiving the messages, stay home, stay healthy, and the reinforcement of that message from the local community leaders. And I think that engagement is something that really is very notable and is remarkable. So as I've had a chance now to spend some time in the Eastern region, and I wore my merch for so I can't wear this very easily on the western side without it inciting a few comments, but I thought it would be probably safe to wear that here. I think that while we have made progress in each of the systems that I've had a chance to see and the regional responses that I've been able to see that have been put in motion and built, while I think our overall performance is starting to show some promise, I think it's critically important at this time to continue to do stay home and stay healthy. We are by no means out of the woods. I think some of you are aware of some areas where we're having some small outbreaks of COVID positive tests. And it's important at this point that we continue to be very aggressive at identifying it, isolating it, and containing it before it takes another toehold in our communities. So I've been so impressed and very appreciative of the involvement of all elements of the community and society in helping what we need to do to keep as many Washingtonians safe and alive as we continue to fight the pandemic. The governor is completely involved with this and personally engaged with every step of the way. And it was his call to me personally that really convinced me that we could do something together to help make this better for not only Washington, but also be a model for the rest of the country. So I'm very pleased to have this opportunity, and I'm also very pleased to find out that Dr. Lutz and I share a kindred spirit with our military background and our service to the Marines. And so that's also something that also galvanizes me to know that we've got the right people in the right place doing all the right things for all Washingtonians. So thank you very much for the warm welcome that I've had here, not only in the region, but the entire state. And I look forward to answering any questions or sharing any information that you might want me to share.
With that, we'll open it up to questions.
So we've seen a massive amount of spending in the state for stuff like PPE gear and testing supplies. what do you think the status of that is right now across the state, and why do you guys continue to spend more and more?
Yeah, great question. So one of the things about PPE is that it is so important for us to keep our healthcare workers, our frontline healthcare workers safe. And I think it's very evident that what we're dealing with is a virus that is extremely transmissible, and it's also very insidious. We know that people who are pre-symptomatic and asymptomatic have the potential to shed the virus onto unsuspecting folks, especially unsuspecting healthcare workers who may be taking care of a patient or an individual or a resident without recognizing what their true COVID status might be. So with PPE, it is really a driver for making sure that the people who are on the front lines of taking care of potentially COVID positive patients have that protection. And the ideal way of using personal protective equipment is that it should only be used once per patient. You don't want to necessarily reuse it unless you're able to decontaminate it. So the governor has been very firm in his commitment that we need to continue to get PPE and have that readily available. The other part about PPE that is so important is that at some point we also want to start looking at what does recovery need to look like. And part of that is also going to be dependent on how well supplied we are with PPE. So that's why you're seeing that ongoing effort to do that. We've had tremendous results with some of our loaned executives from Amazon and Microsoft who've been so helpful in not only helping us procure from the Strategic National Stockpile, but also helping us identify supply chains that we can order and procure at the state level. But we've also had tremendous support in donations from private industry and individuals.
And you see the field hospital being packed up on the west side, and our peak resources for hospitals here across Washington, we saw that we've already passed that date. So is it kind of going faster than you guys expected with this recovery, or is it kind of right on par?
Great question, and I want to be very guarded in my optimism here and guarded in my, in how we're seeing this. We realized that when we started preparing for the surge, that we actually had we had more capacity in our system when we started working together as a collective, instead of each hospital trying to figure out what their own individual capacity was. We realized that if we started bringing hospital systems together, that they were actually able to identify much more capacity and also a sharing of resources that we had previously projected. And so when we started looking at it through that lens, and we actually started to have a better feel for what our numbers were saying about the response to testing and identifying people with COVID positivity, that we could handle the surge in Western Washington. And as you know, that was right about the same time that we were seeing a very significant uptick in other parts of the country. And so we really felt very strongly that our role here was to really hunker down and continue to maximize our capacity here, but at the same time be able to help people in other parts of the country where they had a more acute need.
Social distancing has been pretty much a good choice through this entire pandemic. When do we start to see that scale back? Is it going to be going through the month of May that we're going to still continue to see social distancing? Because that's what the models are based off of from the University of Washington.
Yeah, thanks. Great question. And if I could introduce, we're really trying to stress that it's physical distancing and not social distancing. We want people to remain social. It's just that we need you to do it while you're physically apart. So we believe physical distancing has got to be a mainstay for how we deal with this pandemic right now. And part of that is because we kind of had a lag before we could really do some testing, and we're still trying to catch up with the volume and the number of people that we need to test, that the only way that we can protect those people that are coronavirus naive, that we suspect have never been exposed to it, is if we maintain our social distancing. And if you look at Dr. Scott Gottlieb's phases of recovery, and he describes 4 phases of recovery, it's really a stepwise fashion for how we would reintroduce ourselves into the normal activities of a society, but it's predicated on being able to do very comprehensive and broad-based testing. So part of our ability to kind of move through those phases and start looking at how we get back is maintaining that I fell into it myself, maintaining that physical distancing.
And another question too, when it comes to the homeless, how's the homeless population within the state dealing with this pandemic? And have you guys been able to keep an eye on those who might have gotten sick? And have there any people who are homeless have gotten sick?
Yes. So great question. And so there's a lot of concentrated effort in being able to shelter the homeless population and to be able to test them so we have a better sense of what kind of risk they might have for carrying the virus. So that is something that's a very organized effort. And I've been so impressed with the efforts to do that and really shelter them in either makeshift areas or in some places renting some of the rooms from hotels in order to do that.
And you're starting to see the number of cases really here on Eastern Washington and really across the state go up still, but in smaller numbers and less hospitalization. So what does that say about the curve right now?
So I think that means that we're starting to either start keeping pace with the virus, and hopefully what I want to do is I want to get in front of it, or actually to the left of it. So we've been kind of trying to catch up with the virus for some time now. I hope that holds. We have to continue our efforts, though, in order to make sure that we're continuing to have that type of impact on the curve. This is not a time to let up, absolutely not.
Is there any chance that here in Eastern Washington we see a little bit more of a delay on this as Western Washington is really kind of starting to wrap up?
So, well, let me address the second element there. I don't necessarily see Western Washington as wrapping up. I think it's really still an ongoing effort. I think the considerations are slightly different for Eastern Washington because you don't have the sea on the other side of you. You have other states who are going through their own evolution of the coronavirus, and so I think that's a different consideration that we have to keep in mind about how safe Eastern Washington is from being exposed to the virus, recognizing that while you've done a really excellent job within the community and you're very mindful about how you need to approach any of these outbreaks, that there may be some additional exposure from areas that you don't have the same type of rigor that you've got here in Eastern Washington.
Vice Admiral, could you address, I know one of your calls earlier this week or last week, it all blends together now. You addressed how Eastern Washington hospital-wise is very different than the West Side. Could you address what you're doing regionally to coordinate partners? I know a lot of them are sitting here, but also in the Tri-Cities in Yakima where they're having a lot bigger outbreaks. Could you address how that's working?
Yeah, thank you for that question. Because I'd been warned that that Eastern Washington was very different, and it's beautiful. I mean, if that's the difference, I've noted that it is very beautiful. But you're right. The health system is structured in a slightly different way, and in rural communities, you have different considerations, whether it's time, space, the distribution of your patients. And sometimes it's even some of the risk factors that you might have in some of your community members, whether they have other conditions that you have to be mindful of. So, but what I have found, and this is what's so exciting, is I spent most of my day yesterday in Yakima and Ellensburg. What I've been very impressed with was how they as a community with the major hospitals there and clinics, what they did is they came together as a collective and as a group decided this is how we're going to surge. And what they did in that process is they identified ways that they could increase their capacity within their organic capabilities and what they would need to do to share across the different hospitals in order to make that happen. The other thing that was so impressive is they've already started doing their drills. They've done these COVID positive drills and actually have moved people through their system just to see how it works. They've also looked at their own pop-off system, like if this hospital fills up, this is the next one we're going to, and within this hospital, this is what we're going to try to preserve as COVID positive or COVID negative. And if our whole system starts filling up, here's where we want to go in terms of what we can set up at Freedom Field. And then any kind of backup is what we're going to provide at Astra if it even comes to that. But what I've been so impressed about when I went to visit them is how comprehensive and detailed their plan is and how they've taken into consideration every iteration of what might happen. So Yes, definitely. I think that there are very unique considerations here in Eastern Washington, but I've been thoroughly impressed with what I saw yesterday and what I'm sure I'm going to see here today in Spokane.
When should we start to see kind of a rollout into the new normal? When we can start opening up barbershops, salons, getting people back to work? I mean, we're losing money, people are losing jobs. When should we start to see kind of a rollout, a roll-in phase into the new normal, but still being cautious?
So I think that's something that's on everybody's minds, and we're trying to figure out what are some of the tangible landmarks that we should start using in order to kind of see ourselves that we might be ready to go towards recovery. Here are a couple of things that we're thinking about. They're not set in stone because this is such an unpredictable virus that we're dealing with. So one of the things that we're looking at is how much stability do we see in our own ability to identify that there's been an infection and then be able to trace who they might have contacted and what's the likelihood of another hotspot occurring. We're not quite there yet. You know, we would like to be. We would like to be able to say, okay, we've got this COVID positive test here, and we know that their contacts include this, so we know that we can position ourselves here and everybody else can keep on going because we think we've got this here. We're just not at that point. And so in that article that I mentioned with Dr. Scott Gottlieb, one of the things they talk about is getting to the point where we are pretty much disease-free, that there are no new cases for at least 14 days. And that's really hard for us to get to right now because we've had some challenges with testing. It's starting to get a little bit better, but we're still having to really work very hard to get the right kind of supplies in order to do it as comprehensively as possible. So as we're having that conversation, we're trying to find those thresholds and those markers or goalposts that can tell us when it's time to move into that. I don't think we're at that point where we can start saying that this is what we're going to use as a threshold. We're just not there yet.
And we know many people who go to the hospital with COVID-19 are getting released. What is it that's working for their treatment? Is it a certain drug that we've heard in the media over the past couple of weeks, or what is it exactly?
So, great question, because there is no known treatment for the coronavirus. But we do know that of the people who get infected with the coronavirus, and we're seeing a slightly different experience than what they saw internationally. But for us, we're seeing, that about 20 to 40% of the folks, maybe sometimes up to 60%, need some kind of additional hospitalization. And about 6 to 10% need ICU care or being on the ventilator. We also know that those people that are most at risk for having a severe expression of the disease are those people that have other medical conditions, those people who might be immunocompromised, people who already have some type of lung injury or lung damage. So we're particularly mindful of making sure that we're giving them the right kind of support in terms of ventilator care. But there is no known cure, and right now the best treatment for the coronavirus infection is supportive. And we know that most people, the majority of people, once they become infected, if they have minimal symptoms or manageable symptoms where they don't have shortness of breath, that they should be able to stay home and isolate themselves and continue to give supportive care to themselves in terms of hydration and symptomatic relief from coughing or the buildup of any kind of phlegm. But it's even more important in those situations to make sure that they're maintaining their physical distance so they can minimize the transmission to others.
Vice Admiral Bono, are you satisfied with the amount of testing that healthcare providers and hospitals are able to provide in Eastern Washington to get a clear enough picture of how it's spread here? Or do you think there needs to be more at this point?
I am not satisfied with the degree of testing anywhere. Anywhere. I'm not even talking about the state itself. I'm talking about the country. I think we desperately need to do more testing, and I understand what the challenges are. What I feel confident about, though, are our senior officials and our elected officials at the state level, and even within the industry and the private industry, are doing everything they can to help us make sure that we have enough testing supplies. UW has been very instrumental in this. Amazon has just stepped up to say that they're going to help us get some swabs. There are so many different elements that are being brought to bear on this. So when I say I'm not pleased with testing anywhere, I'm not trying to criticize anybody. It's just that the reality of our ability to be more effective in handling this pandemic is to have very broad testing available, and we're not there.
And you talked about how you guys are kind of tracking this whole thing. So how are you guys tracking it specific to the curve going down? Is it a certain rate of cases rising or hospitalizations? What's the factor that you guys are using to track this?
Yes, all of that, really, because, we're watching the death rates, and we're watching the infection rate, and, we're watching all of that. We're even monitoring what we call COVID-like illnesses that are presenting to the emergency department, because we know that there's a certain symptom, constellation that we know people will present with coughs and fevers. And we're monitoring that to see how many of them go on to hospitalization. So we're taking as much data as we can, including our testing data, to see what type of curves we're generating on here. And we try to extrapolate on that, recognizing that we probably have to give quite a bit of buffer above and below our data points to make sure that we're including, or at least having, a more realistic picture of how this virus is behaving in our different communities.
And so you mentioned the COVID-like illnesses. How is that different from the hospitalizations for those visits?
So what we're seeing are the COVID-like illnesses are what we do syndromic surveillance, which is something that we've always done. And this is primarily in the emergency departments. So when we see an uptick in the number of patients going to the emergency department for syndromic-like illnesses, what we do is we track to see what percentage of them go on to hospitalization. And from that, we're able to kind of judge, how much more impact we might be experiencing from the disease itself. Ideally, we'd want to track those hospitalizations to see how many of them are actually COVID positive, and then be able to see how they go through the healthcare system and what our survivability is, and how many of them go on to the ICU and ventilator.
Do you have any sense for what those numbers look like in the Spokane area right now?
I don't have the exact numbers because I've been, I know that we've been following this by region, so I would have to kind of break that out for Spokane. And we actually kind of stratify that in terms of age group and other demographics. So in order to get a real good picture of Spokane, we have to do I would have to look at the data through just a Spokane lens.
Can you speak to Eastern Washington as a region?
So your numbers right now as a region kind of lag what we saw in Western Washington, but they're not as high. And so I think part of what I'm hearing and what I'm observing is that you here on the eastern part of the state had an opportunity to learn from what happened in West Washington. And so I think that's that may be a part of what we're seeing here.
Any more questions?
Thanks very much. I really appreciate taking the time to spend with you, and I'm looking forward to my visits later on today. Thank you.
Thank you.